Hello everyone, I'm Dr. Jacques Conradie from the Department of Neurosurgery at Kimberley Hospital in South Africa. Malignant myopericytoma is a rare tumor with only 14 cases described in the literature. 3 from these were Epstein-Barr virus positive and only 1 found intracranially. In this case presentation, we will present a patient with Epstein-Barr positive malignant myopericytoma, the second documented case found intracranially in the literature. A 33-year-old male presented with new onset seizures, no other than relevant history except that he is HIV positive and on highly active antiretroviral therapy. He had a viral load of 19,100 copies per milliliter and an absolute CD4 count of 274 cells per microliter on presentation. His examination was unremarkable, and other blood results and septic markers were within normal ranges. Contrasted CT brain revealed a large intraparenchymal lesion with invasion into the superior sagittal sinus. It demonstrated good contrast uptake with irregular borders. MRI demonstrated a hypointense lesion on T1 with ring enhancement when contrast was given. The lesion was hyperintense on T2 and a clear superior sinus thrombosis was demonstrated on the venogram. With the imaging and blood results, the diagnosis was unclear at this stage, but due to his HIV status, cerebral tuberculosis was suspected to be the most likely diagnosis. He was taken for craniotomy and frozen section plus minus resection of the lesion to determine the diagnosis. Intraoperatively, the tumor was very fibrous and adherent to the surrounding tissue. Frozen section demonstrated a spindle cell tumor with so-called Staghorn vascular pattern. Myopericytoma was then suspected, but immunochemistry studies were requested to confirm the diagnosis. The remainder of the tumor infiltrated into the superior sagittal sinus, which made total resection impossible. Debulking of the tumor inside the sinus was attempted, but a portion of the tumor was left in situ to prevent catastrophic damage to the venous sinus. He recovered well post-operatively, and CT revealed almost complete resection. Immunochemistry was positive for Epstein-Barr encoded RNA, smooth muscle actin, CD99, and BCL2, but it was negative for Desmin and STAT6. Smooth muscle tumors are typically positive for smooth muscle actin, and myopericytomas are commonly negative for Desmin. It also demonstrated increased cellularity, nuclear atypia, pleomorphism, increased mitotic activity, and necrosis, as seen in malignancy. Subsequently, the diagnosis of a malignant myopericytoma of the true malignant hemangiopericitoma group was made. At 3-month follow-up, he was still well. He had no seizures since discharge, and MRI at this stage did not reveal any local recurrence or metastases, but only confirmed the residual tumor that was left in the sinus. No adjuvant therapy was done, but he was continued on his highly active antiretroviral therapy. The plan at this stage was to do yearly MRI to assess for recurrence. It is well known that human immunodeficiency virus and acquired immunodeficiency syndrome is associated with certain malignancies. After all, it was the rising incidence of Kaposi's sarcoma in young homosexual men that led to the description of HIV and AIDS as an actual disease in the 1980s. The development of malignancy in immunocompromised patients is attributed to co-infection with oncogenic viruses such as Epstein-Barr virus, human herpes virus 8, and human papillomavirus. Malignant myopericytoma is difficult to classify but seems to form part of both the hemangiopericitoma group initially described by Stout in 1942 and the EBV smooth muscle tumor group found in immunocompromised patients. Due to its rarity, no treatment guidelines exist. In all documented cases, surgical resection was done with adjuvant therapy, either chemo or radiotherapy. In this case, like the treatment for Kaposi's sarcoma, highly active antiretroviral therapy was used to treat the underlying immunodeficiency in an attempt to prevent recurrence, which has been successful thus far, though further research into the tumor is required.